This is the manual muscle test for flexion of the metacarpophalangeal and interphalangeal joints of the thumb. The muscles being tested include the flexor pollicis longus and the flexor pollicis brevis. To test for grades 5 and 4, the patient is positioned and sitting with the forearm supinated. To test for the flexor pollicis brevis, the clinician applies force to the proximal phalanx into extension. To test the flexor pollicis longus, the force is applied to the distal phalanx into extension. Please note that there is difficulty distinguishing between grades 5 and 4 in the thumb, therefore the grades are not tested individually. If the patient can hold against strong resistance, they earn a grade 5 for each test.
Bring the thumb across the hand. Hold. Don't let me move you. Relax. Bring the thumb across the hand. Don't let me move you. Relax.
For grade 3, the clinician observes the MCP and IP joints as the patient attempts to flex the thumb. If the patient is able to complete full active range of motion for each joint, they receive a grade 3.
Bring the thumb across the hand. Relax.
For grades below 3, the clinician palpates the tendon of the flexor pollicis longus or brevis and observes the amount of motion the patient can complete. If the patient can complete partial range of motion, they're given a grade 2 for that muscle. If there's palpable muscle activity with no motion occurring, the patient earns a grade 1. If there's no discernible palpable activity, the patient is given a grade 0.
Bring the thumb across the hand. Relax.